Going beyond your role and that of your professions working alongside you is understanding and appreciating the ethical obligations we and others are bound by. Lucy previously contrasted the ethical obligations between that of a doctor and a social worker. The multidisciplinary team I'm referring to would additionally encounter an intersection across the following codes of ethics, which can be seen on the accompanying slides. Though each profession's code of ethics is, in the reality of practice, not always referred to in ethical crisis, Donna McAuliffe argues that it is interesting to observe where professions' core values and areas of focus lie in these documents. Accountability is an identified tension evoker. Several studies note that often the consulting doctor will assume the ultimate accountability for the patient. In a highly effective multidisciplinary team, equal accountability is dispersed across the team. A number of scholars have observed that social workers are often perceived as secondary professionals, while other professions of the multidisciplinary team, and more commonly doctors, will inherit greater dominance and influence. Rosalie Giles concludes that as a result, the dominant profession can define expected standards of performance and techniques in ways that limit the contribution of other groups. Approaches to overcome, and better yet, prevent the rise of tensions were suggested by multidisciplinary team members in Giles's research and supported by existing research. Approaches include transparent and direct communication, a dedication to seeking solutions and practicing humility and respect within and toward the multidisciplinary team. In fact, Freeth et al. Have found that there is a notable shift in reference and practice towards interprofessional teams that share and operate with a common purpose, commitment, and mutual respect within the health sector. Given the extensive research that supports the relationship between positive outcomes for patients and effective multidisciplinary teams, Epstein believes that it is crucial as we, as malleable social workers, learn and practice these approaches and be aware of the ethical obligations and potential tensions that may arise working interprofessionally in the health context. Thank you. The question for this section is, briefly describe your professional role and scope of practice. If you have not yet had professional experience, describe what you would like your role and scope of practice to be. Please post your answer in the comments section under this video.